I'm Kyler.
I'm Drew.
I'm Gavin.
And I'm Alex, and we are nominating Dr. Whitehead for the Necro Foundation's Patient Choice Award. You wake up, you're hazy, you've clearly lost a lot of functions, but you have no idea what's really happened, so you're kind of trying to figure out what you can and can't do, kind of testing boundaries, seeing what is possible, and it's just very disorienting.
I have really come to accept that I can still get through this. It's just going to take a lot more effort to get through this.
I think the brain is such a fickle thing in itself, and as you can tell, we all have the exact same thing, and we're all still to this day affected completely differently. And then there's some people out there where they find it and it's too deep in the brain for them to even do surgery, and they just have a time bomb. Or there's people out there where their surgery option is going to cause more harm than it should. Or there's people out there like me where I only lost my peripheral vision on my right side. And I think that it's critical that every single person should be able to have an option of a safe way to fix a problem. And I think even though it's not super common, it's not affecting a ton of people, the people that it does affect has a great effect, and we should do everything we can to minimize that.
Dr. Whitehead made me stronger than I was because he saved my life. And so now I can walk out of the hospital and seeing everything that I've gone through with the whole procedure, that I can walk around and be like, I know that I'm stronger.
AVMs, while they're so rare, I think they come in a lot of different shapes and sizes. And I think all four of us owe our lives to Dr. Whitehead and him being able to see each specific case and knowing what to do, when to do it, and how to do it. And I think that's why we're all sitting here today, because we owe everything to him, and he deserves the world.
Remember, he was quite kind, very patient with me, especially when I was going through my therapy.
First time we kind of like shook hands, became people. He always had a very good sense of humor, and he introduced himself, he held himself very well, and he was very confident in what he was talking about, which made me feel a lot better. He's very confident, he's like, oh, this is very routine, I've done this before, all of this like very calming, reassuring things to make me feel a lot safer.
I'll wake up some mornings and I want to completely forget what happened, or I wake up some mornings and I'm blessed because I've had a really hard day and I know that I can do it because I've been through something hard. And just kind of this one period in my life, 8 years later, I'm still being affected on it. And then I look at Dr. Whitehead, who day in, day out, hours and hours a day, this is what he's doing, this is what he's surrounding himself with, and he's working to be the best at it, and he's working to save lives.
He's very good at what he does. I know he is, because, I mean, for me to have a brain bleed and walk out, you know, he's the best of the best, for sure. So that's why I think he is deserving of this reward.